going to look at the Philadelphia collar, the Aspen. I have the Vista of the Aspen, and then we're going to look at a TLSO. So if you're not familiar with the acronyms and so forth, sometimes you might see these called a CO, that's cervical orthosis, and sometimes you see a CTO, and that's where one more like this style, not the Philadelphia collar, one more like this style will be attached to a thoracic section that kind of sets over their shoulder and straps around. It's a little more restrictive than just the collar, and the only thing that they normally do more than that would be then if somebody has a halo on. So if they need a little bit more support than this, you'll sometimes see a CTO. Then we have, this one is a TLSO, and so the initials are what are we trying to restrict? Where are we trying to support and restrict? So this one's up in the thoracic region. We got the lumbar, okay, and the sacral. So LSO, lumbosacral orthosis, TLSO, thoracic, lumbar, sacral orthosis. So let's start with the Philadelphia collies. A lot of times these are already going to be on when they come, and so hopefully they stay in place. But how folks are on medication and so forth, you might come in the room and two pieces are laying on the floor. What do you do? And then how do you get it back on safely? Most of the time, if you look at these, you're going to see something that'll tell you which is the front and which is the back. So here we got front, and it's literally written on there. And here we got back, and it's written on there. We have an arrow up and an arrow up. Most of the newer braces are going to have that type of information on them. If you look for it, you should be able to see it. But if not, if you just have these two pieces laying here, and you're like, I wonder which one goes in the front. Well, we got a trach hole there. Most of these cervical orthoses are going to have trach openings. So there's no reason to have an opening in the back. So there's the front. And you can also see that looks like a chin would sit in it. And then you can see how that would resemble sitting in the back of the head. So a lot of times, if you're not familiar with a particular brace, just kind of take a deep breath, start looking at it, saying, okay, how might this go together? Let's see if we can find any words on it, any arrows and things like that. So what we want to do then to get it on when they're laying supine is go ahead and get this one across the front. And then most time, if we can, we're going to log roll them over and slide this one in from the side. So there'll be sideline, we can get it in like that. The back piece overlaps the front on this brace like that. And then it connects. Sometimes if they're allowed to be up more, I have seen where you'll sit the bed straight up, have this one in the front, kind of hold, stabilize them here, and then bring the other brace, the back part in sitting. So a lot of times it all depends on what you're dealing with as far as what type of surgery. Most of them you'll be seeing are surgery related, but sometimes, you know, if it's involved in an MBA or something, we're really got to see what's going on. Is this something that was fixed by the doctors where they went in and put some fixation in there? Or is this something that they're kind of watching to see if it'll heal on its own? And that kind of tells us, you know, how timid we have to be in getting these braces on, making sure that there's no movement, things like that. The Vista fits much similar way, only it's a little bit more flexible in the back. These are more of a long-term brace, but these are more short-term. So they could be wearing this for quite some time. And these pads pull out and can be replaced and washed and things like that. Now this one, we don't have any arrows or anything on this. It doesn't even say front or back, but we do have writing. So their branding says Aspen. Down here it says Vista. So if we're trying to figure out, okay, this goes on the back, but which way, writing will point up. And then this is the front. A lot of these braces, these collars pretty much don't have any adjustments. It's the two Velcro straps. Most of the other ones somehow are going to have adjustments. This one has this little knob in the front that we pull out, and then we're able to rotate her up and down depending on if we have a short neck, long neck person. So these fit more of a variety of neck sizes, where these you got to go more specific and keep all different. Like this one's a 3 1/4 circumference, 13 to 16-inch neck. So these are going to be real specific. These will be less specific. Another brand's the Miami. We use a lot of the Miamis. And the Miamis are the same way, where you have like medium female, stout male, long skinny neck. There's about 4 or 5 different sizes that will fit people a lot more closely. Then we have TLSO, and the only difference really between the TLSO and the LSO is the LSO will be cut about here and won't have this front attachment. So we have, remember, lumbosacral orthosis, thoracic, lumbosacral orthosis. It's going to have straps. These straps can be made to come under the arm like this when it's on. I've seen that some, but I don't like it. These need to be over the shoulder to help hold this part of the brace right here. And, you know, unless the doctor or somebody else okays it, then, you know, it could be under here. But most time, if we're not sure what to do, this needs to go over the shoulder. It really helps hold this piece right here. And what we're trying to prevent with the TLSOs is we don't want forward flexion, we don't want side bending, and we don't want rotation. Now, if they say, well, I can still do that in this brace, yes, they can. You can force your body to do anything in any of these braces. The braces are more there for support and to be a reminder, hey, you're not supposed to do anything, like side bending, forward flexing, or rotate. But yes, if they force the issue, they can probably do just about anything they want to with this brace on. Most of these now are going to be Velcro braces, real easy to get on and off. Couple styles do have buckles, kind of like backpack buckles, but most of them, well, this is backpack buckle, similar to one here. But most of them now have these front closures that are Velcro. So when they put it on, once everything gets adjusted, it should come around front and Velcro in place. And then there's these little tabs they can put the thumb in. They put those in and they can kind of customize the fit how tight they want it. Okay, so that's real good and easy. With me standing, I can get this on, pull the straps over my shoulders, and I can do this all by myself and we're good to go. But what? I'm standing up. And this is somebody that's just had surgery, and we got orders in the chart that say patient supine in bed, no out of bed without the brace on. So no out of bed without the brace on doesn't mean that I'm laying in bed, time to get up for therapy. All right, put my brace on. They can't do that. So how do we get the brace on them in bed? How do we get them sitting up to the side? Because they can't throw a leg off the side of the bed now and just get up like this like they used to. Because that's twisting and contorting the back. And if the doctor just did, let's say, a lumbar fusion or something, day 2, they throw a leg off the side of the bed and jerk their leg to get up. They may just tear up everything he just did. So we got to look at how can we get them up safely. So the first thing is, when they're laying in bed, we want to get them over on their side. Everything's got to move together. So the shoulders, hips, and knees all have to move as a unit, what we call log rolling. We'll normally have them bend at least one knee up, and they kind of push with that one. We're going to have them reach over, and then we're going to help make sure that their whole body rolls as one segment. We can slide the brace in from the back, roll them back over onto their back, tighten it down, roll them back over and help them sit up on the side. So it's going to take longer, but that's what we've got to do in order to prevent injuries to us and definitely protect the patients. All right. So Ms. Peggy, we're going to get you in a brace today for your neck. And so this piece we're just going to slide here on the front. And of course, remember to tell them, okay, we don't want to move much. We're going to do all the moving. We'll get this on you, because they'll say, well, here, I can pick my head up. All right. Okay, so what we're going to do now is we're going to roll you over to the side. So we want you to pick, hold on. We're going to go slow. We're going to bend this knee up. All right, you're going to reach over this way. Slide. Okay, stop right there. All right, and now we want to roll to your back. Come up nice and slow. All right, relax. How's it feel? Okay? Not choking you or anything? Not the most comfortable brace in the world, but it's going to do what we need it to. All right? The orthotist or whoever's fit the brace for you, everything's pretty much in place, and all you're doing is trying to get it on. But every now and then, maybe they've tried to do some of their own adjustments while nobody is around. And then you got to look at it and see. So a lot of times what I'm going to do is before I get ready to start moving them or anything, I'm going to do as much looking and adjusting as I can. And more so with the TLSO, we're going to lay that top plate on them and make sure that everything lines up before we say, okay, here we go. And then, oh my goodness, we got to do all kinds of adjustments. So that's going to be about where we want. Okay, we're going to get this collar on you today, this brace. So it's got a front part and a back part, and we'll get the front part on, then we're going to have to roll over to the side and get the back part on, okay? Doctor wants this on. It's going to stay on all the time. And it's not going to be the most comfortable thing, but it's going to help you get healed up, all right? All right, now we're going to roll over to the side, and I'm going to help you. We're going to bend this knee up, and we're going to roll to your right. We're going to make sure that your shoulders, your hips, and your knees all go at the same time. So reach over with your left hand toward the rail. All right, good. And of course, the best thing is going to be for two people. Because really somebody's got to be back here placing it. You definitely want somebody over, even with the rail over there, you're still going to want somebody over there to kind of help hold. Because last thing we want is for hips to fall back or anything like that and lose this position where we have everything lined up straight. All right, now come back toward me.
Now, we do have patients brought to the floor from an MVA that these collars have been applied and they've still got dirt and grime and all kinds of stuff.
Even though it will work on this material, eventually the best thing is 50-50 water and alcohol for all these type of braces. And then that way we know we're not leaving any soap residues or anything on them. Now, that's a problem on the floors because most floors that I've been in rehabs and the hospitals, you don't have bottles of alcohol. You have alcohol preps. So if all we have access to is alcohol preps, yes, it will work on this material eventually because it's a porous foam. But we know that we're getting it clean. So if you have to, wipe them out with alcohol preps and that'll be fine. If they're here long term and it ends up breaking down, the foam in the collar will get more foam. Okay. Surgery. So that they come to the office and we fit them with this while they're able to be up and around and moving, and we've done all the adjustments, and then it's put on them right after surgery. Well, just this past week, one of the doctors had a lady scheduled to come by and see me on Monday, and I never saw her, which I don't know all their cases. I just saw her on my schedule, and Miss Smith didn't show up. And then the hospital here called on Thursday and said, where's Miss Smith's brace? And I said, really? Oh, was it ordered? You know, I get nervous. And then I go in and look at the computer. Oh, yeah, I was supposed to see Miss Smith on Monday and she didn't show up. So then we're doing this after surgery. trying to get this brace fit, and she's uncomfortable and doesn't want to be moved around and things like that, which she could alleviate that if she would have made her appointment on Monday. So like I said, first thing we want to do is kind of look at this front. And we're going to want this brace, we're going to get it as low as we can in the front, so we want it down to hit the pubis. And then we want this 2 finger lengths down from the sternal notch. So we come right here, 2 finger lengths, and then that brace should be right about here. It's going to go up just a little bit when they sit, and that's okay, because with that 2 finger lengths, now we're just right at the sternal notch. When they stand up, it will come down a little bit, but we don't want it down here either. This isn't doing much for the upper thoracic region, so we want it up pretty high. And even though it's right here and there's plenty of room, they're going to tell you it's in their throat and it's choking them, and it's not. But we want as much length on the front as we can get. So that's where they're getting protection from it. And the other thing for the ladies is if we get it too short, then we're in their breasts. So hopefully when it's being fit, all that's taken into consideration. So pretty low in the front. And we're 2 finger lengths right there, so that's about right. And the other part is just looking at the other adjustments. Hopefully we're real close to where we need to be. We only have so many options because these braces come in different sizes. So this is a medium. If you pull these panels back, you can see in here's where the adjustments are. And it actually tells you extra small, small, and medium. So we're in the medium right now. Make sure both sides are equal. And we want to make sure that these straps aren't pulled around. They're back here. Got the brace stretched out on both sides. All right, we're going to get this brace on you now. And so what we're going to do is we're going to roll you onto your side. Have you done this before? All right, 1, 3. We're going to roll to your right. 1, 2, 3. Okay.
So it's a 2-person job.
Yep. We're going to have somebody in front. And then the bed, we're going to push and slide this under as best we can get this back piece under. The back piece doesn't have any adjusting. Big thing is we just don't want to see that she's in a real small brace and that she's a real tall lady and it's not coming to the upper thoracic region. So we're going to try to fold as much of this up under her as we can.
I'm so proud.
So what we should see, we don't want this cutting up into the shoulder blades at all, which it shouldn't. It's coming up in between them. And it's coming up probably right about to T1. So coming up real high in the thoracic region, which is what we want. Try to make sure our straps for that side go under her, because when we roll her back, we don't want to keep doing this back and forth. So take the time when they may say it's killing them when they're on her side, but let's make sure that we got the brace under her as far as we can. The other thing I'll do when you have 2 people, so I'm going to keep pushing until she starts coming back on my hand to make sure I got as much up under her as I can on that other side. All right, we're going to come back over to your back. Good. We had the whole thing over there, so we have it just how we want it. We're going to be close. Let's see if that can come around. It might be just a hair high. probably need a bigger size, but we got close. We can't really try to draw this back just a hair. All right, let's see if I can start a little bit better. And the other thing is this needs to be contoured. So you can see for her, it's up off the chest wall. When it's fed, it should be contoured. It's just not pulled out of the bag. And here's your price. So we'll contour this to make sure that we have good contact here, not too much, not too little contact on the sternum. And then same thing, now she has a brace on, she's still not free rein to get up. Okay, we're gonna come over this way. We're gonna bend this right knee up. We're gonna roll to the left this time. Reach over here with your right hand. We're gonna come to your side. You okay? All right, now we're gonna sit on up. So she's gonna bring her knees on up. We're gonna kind of hold these and not let them fall. That way we're keeping everything in a straight segment. I usually come up under them and grab a hold of the brace. That way we don't want to crank on their neck to pull them up. So get a brace, get a shoulder. We're gonna come up on 3. 1, 2, 3. Remember, be ready for whatever the first time up. They may go backwards, they may come forward, something might come up. we can see now it's up a little bit high. We're not quite as low, and she's got stuff in her pocket. We're not quite as low as we want to be, but really undo this and kind of get it down where we want it. But we want this down in the front, right about there. We want about as low as we can get where it's not cutting into their thighs when they're sitting in a 90-degree chair. So the bed, it should definitely not be bothering the bed because their legs are probably at 60 degrees or so. But here's where we really see what the brace is going to look like on the front. When we get them over in this bedside chair, that's about the position that we want. We want it as low as we can get it without it cutting into their thighs, and really about as high as we can get it without it choking them. Same thing in the back. When you're looking at the back of the brace, as long as it's not digging down into the bed, we want it pretty low. It shouldn't be up like this. It should be down low in the bed over their hips. This belt is really made to come right here, right at the iliac crest. So a little bit of it down should be right above the trochanter. So you got your hip bones, where you feel your hip bones sticking out from your leg, the trochanter. That belt should fit right here. So it's going to be iliac crest to be involved. Then coming right up from that, it's going to wrap around. So it's made to be restrictive. It sits low on the hips, and then it sits up high in the front.
And did you show them about the thumb?
Yep, and then the thumbs are what tighten it down. These little thumb pulls. That's where they kind of customize the fit, how much tighter they want it.